Welcome to your personalized deep dive.
Yeah.
Today, we're going to be exploring kind of this incredible intersection of technology and healthcare,
Oh, wow.
where we're looking at a special type of microscopy called stimulated Raman scattering microscopy,
Okay.
SRS,
Yeah.
and how it's being combined with artificial intelligence
Okay.
to transform how we diagnose and treat brain tumors.
Interesting.
So SRS actually allows us to see biological samples like brain tissue without needing any dyes or labels.
Wow.
It's almost like capturing the microscopic world in action, seeing these tiny structures interacting in real time.
Yeah, it really is a fascinating leap forward from how we traditionally think of microscopy,
Right.
where you have to stain things, prepare them.
Yeah.
It takes a lot of time.
Exactly.
With this, we can see the dynamics of the cell in real time.
So it really speeds things up.
Yeah.
Why is that so important in this case?
Well, think about a brain tumor, in this case, gliomas.
Okay.
Early and accurate diagnosis is absolutely vital, but often, accurate diagnosis relies on specialists and often expensive testing,
Yeah.
which can limit timely care, especially in areas of the world where there are limited resources.
So we're talking about an advancement that could potentially democratize healthcare, making it more accessible to more people.
Exactly.
Okay, let's unpack this SRS microscopy a little further.
Okay.
We have a few papers here, and one of them, Freudiger et al. From 2014, really lays out this breakthrough in SRS.
Okay.
Where does this all begin?
So SRS is based on the principles of coherent Raman scattering.
Okay.
And in this 2014 paper, they really developed a robust SRS system based on fiber lasers.
Okay.
This was a game changer because it made SRS more practical, more accessible.
Got it.
Before this, you had to deal with a lot of noise in the laser, and the timing of the pulses, which are key for this technique to work.
Right.
Wasn't perfect.
Mhm.
They made some real innovations that really cleared up those issues and made it much more viable,
Yeah.
especially for biological specimens.
So it became a lot more practical, especially for its medical application.
Right.
And speaking of the medical application, that brings us to the AI.
Yes.
We have this incredible microscopy, SRS, where we're able to capture these real-time images of brain tissue.
Uh-huh.
But now we have another paper from Holland et al. In 2023
Okay.
that introduces DeepGlioma.
Yes.
What is this?
So DeepGlioma is a deep learning model.
Okay.
It's an AI, essentially, that was paired with SRS microscopy to actually analyze those images.
Got it.
It was trained to look at those images and predict the molecular features of that brain tumor.
So it's almost like the AI is looking at the microscopic fingerprint of the tumor, and it can tell us what kind of tumor it is.
Exactly.
Oh,
And
yeah.
what makes deep glioma even more valuable is that different gliomas respond differently to treatments.
Yeah.
This is really important.
Yeah.
Deep glioma is able to look for these genetic markers that are crucial in classifying and treating these tumors.
Okay.
Things like IDH mutations, 1p19q co-deletion, ATRX loss. These are things that are very important for how you treat that tumor.
So we're not just talking about identifying a tumor.
Right.
We're talking about classifying it in a way that can inform treatment decisions.
Right.
And one of the things that really jumped out at me in this paper is the speed.
Yes.
How fast can DeepGlioma analyze these images?
So deep glioma can analyze tissue biopsies and actually make a prediction in under 2 minutes.
Wow, under 2 minutes.
Yes.
When you think about traditional diagnostic processes, that can take days or even weeks.
Absolutely.
So this really does have the potential to revolutionize how we diagnose and treat these conditions.
Yes, especially in time-sensitive cases like brain tumors.
Absolutely. And the paper also mentions that this was tested in real-world settings.
Yes.
This wasn't just a theoretical study, right?
Right. It was tested across multiple medical centers.
Wow.
And showed an average classification accuracy of 93.3%.
That's incredible.
That's pretty remarkable.
So this is a technology that's already being validated in clinical settings.
Yes.
Which is really exciting, but the innovation doesn't stop there.
Right.
We have another paper here from 2024, Kanapudi et al., introducing FastGlioma.
Okay.
What can you tell us about this development?
So FastGlioma actually builds on the success of DeepGlioma,
Okay.
but it has a different focus.
Okay.
It actually focuses on helping surgeons detect tumor infiltration during surgery.
And why is that so important?
Because getting all the tumor tissue out is crucial.
Yeah.
Even tiny bits left behind can cause the tumor to regrow.
Right?
So FastGlioma acts almost as a microscopic guide for the surgeon,
Yeah.
helping them to ensure they've removed all of the tumor.
Exactly.
And it does this incredibly quickly.
Oh, wow.
It can analyze images in under 10 seconds.
Wow, that's amazing.
Imagine a surgeon right there in the operating room receiving real-time feedback as they're operating.
That's incredible to think about how technology is changing the landscape of surgery, potentially making it more precise and effective.
It really is.
Yeah.
And what's fascinating is that FastGlioma wasn't just trained on images of gliomas.
Okay.
It was trained on a massive data set of images from diverse tumor types.
So it's able to learn general patterns and apply that knowledge to different types of tumors, not just gliomas.
Exactly.
Wow.
They call it a foundation model because it builds this foundation of understanding from a wide range of examples.
So it's almost like it's learning to see the underlying structure of tumors, regardless of the specific type.
Right.
And how does FastGlioma compare to the traditional methods that are used for surgical guidance?
Okay.
We're talking about things like MRI and fluorescence.
Well, the researchers did a head-to-head comparison.
Yeah.
And FastGlioma actually outperformed both of those methods in accurately identifying tumor infiltration.
Wow.
So we're talking about a potential game changer in terms of how brain surgery is performed.
Absolutely.
Yeah.
Okay, so we've talked about these incredible technological advancements.
Yes.
But let's connect this back to our listener.
Okay.
Why should you care about all of this?
Sure.
What does this mean for you?
Imagine a future where these technologies are widely available.
Okay.
It could mean faster diagnoses, more precise surgeries,
Right.
and ultimately better outcomes for patients.
And it's not just about speed and accuracy, is it?
No,
It's also about access.
that's a critical point.
Right.
This technology has the potential to democratize glioma care,
Yeah,
particularly in areas lacking specialists or expensive diagnostic tools.
exactly.
In low and middle income countries where resources are often stretched thin, this could be a game changer.
It could empower healthcare providers in those regions to make accurate diagnoses and treatment decisions without relying on resources that may not be readily available to them.
Exactly.
And the potential applications go even further.
Yes.
Remember how I mentioned that FastGlioma was tested against other brain tumor types with success?
Right.
This hints at its potential as a versatile tool for brain surgery in general, not just for gliomas.
Yeah, it's really an exciting time to be following these developments.
Absolutely. Now, I know we've covered a lot of ground here.
Yes.
So I think it's important to delve a little deeper into the science behind all of this.
Okay.
Let's start with the basics of stimulated Raman scattering microscopy.
All right.
How does this technology actually work?
Okay.
Yeah.
So at its heart, SRS involves shining two lasers at a sample, let's say a piece of brain tissue.
Okay.
And if the frequency difference between those lasers matches a specific vibration of a molecule in that tissue, something interesting happens.
Okay, what happened?
Essentially, those molecules get excited.
Okay.
And this excitation causes a change in the intensity of one of the laser beams.
Got it.
And by measuring this change, we can actually pinpoint the types of molecules in the sample and build an image based on that.
So it's like each molecule has its own unique vibrational fingerprint, and SRS can detect those fingerprints to create a detailed picture of what's happening at the microscopic level.
That's a great way to put it.
Wow.
And because we don't need to stain the sample,
No.
it really opens up the possibility of seeing these dynamics unfold in real time.
That makes perfect sense, but there's a specific type of SRS that's particularly relevant to our discussion today,
Yes.
and that's stimulated Raman histology, or SRH.
Right.
What's the difference?
You're right. SRH is really what brings this to the realm of histology.
Okay.
Think about it as being able to perform a biopsy and get instant microscopic analysis of the tissue without all the traditional processing and staining.
Wow.
It's like a real-time microscopic look inside the tissue.
So it's providing the kind of information a pathologist would normally look for, but with incredible speed and without the need for those extra steps.
Exactly.
And that's where the AI comes in.
Yes.
SRH provides this wealth of visual information,
Right.
but it's the AI that can really make sense of it all.
Precisely.
So the AI acts as the interpreter,
Yes.
analyzing those microscopic clues to identify the type of tumor and its characteristics.
Right.
And that brings us back to DeepGlioma and FastGlioma. Can you remind us what makes these two systems unique?
So DeepGlioma from the 2023 paper by Holland and colleagues focuses on providing a fast and accurate molecular diagnosis.
Okay.
Think of it as a pathologist.
Yeah.
But one that can analyze the molecular features of the tumor instantly,
Right.
guiding those crucial treatment decisions.
In FastGlioma, from the 2024 Kondapudi et al. Paper, takes this a step further into the operating room.
Right. FastGlioma assists surgeons during surgery, giving them that real-time feedback on whether they've removed all of the tumor cells.
It's like having a microscopic map of the tumor to guide the surgeon.
Exactly.
Okay, so let's dig a bit deeper into how these AI systems were developed.
Okay.
How do they achieve this remarkable accuracy and speed?
Well, DeepGlioma, being a deep learning model, needs to be trained on a massive amount of data.
Okay.
The researchers used a huge data set of SRH images, each one labeled with the actual molecular profile of the corresponding glioma.
So the AI learns to recognize the visual patterns associated with different types of gliomas.
Right.
Almost like learning to read the tumor's microscopic fingerprint.
Exactly.
And then, importantly, they tested DeepGlioma on a separate set of images it had never seen before.
Right.
To make sure it could generalize to new cases.
Absolutely.
That's a crucial step in AI development, making sure it could perform well beyond the examples it was trained on.
Right.
And the results were quite impressive.
Yes.
Over 93% accuracy, which is remarkable for a system that can provide a diagnosis in under 2 minutes.
It really is.
But FastGlioma, with its focus on real-time surgical guidance, faces a slightly different challenge.
Yes, because speed is absolutely critical here.
Yeah.
We're talking about providing feedback in seconds, not minutes.
Right.
So instead of focusing on the molecular diagnosis, FastGlioma was trained to identify the boundaries of the tumor to differentiate between healthy brain tissue and the cancerous tissue.
So it's more about determining where the tumor ends and healthy tissue begins.
Right.
Which is crucial for the surgeon in making those real-time decisions during the operation.
Right. And to achieve this level of precision and speed, it was trained on an even larger data set than DeepGlioma,
Wow.
including images from various types of brain tumors, not just gliomas.
So it has a broader foundation of knowledge that allows it to adapt to different situations.
Yes.
Which is essential in a surgical setting where you might encounter variations in the tumor.
Exactly.
That ability to generalize is key to its success.
Yes.
So we've laid a good foundation for understanding how these technologies work at a technical level.
Okay.
Now, what about the real-world impact?
All right.
How are DeepGlioma and FastGlioma changing the way we diagnose and treat brain tumors in practice? We've been talking about DeepGlioma and FastGlioma and how these AI-powered systems are changing the landscape of brain tumor diagnosis and surgery.
Yeah.
But I'm curious about how this is actually playing out in real-world clinical settings.
Okay.
How are these technologies being integrated into the workflow of hospitals and operating rooms?
Well, one of the most exciting aspects of DeepGlioma is its potential to address the issue of access to specialized care.
Yeah.
Think about those areas where there might not be a neuropathologist readily available.
Right.
The traditional process of sending tissue samples to a distant lab can take days or even weeks.
Yeah.
But with DeepGlioma paired with SRH, which gives us that instant microscopic imaging,
Yeah.
the entire diagnostic process can happen right there in the operating room.
So we're talking about a scenario where a surgeon in a remote area can perform a biopsy, get those microscopic images immediately,
Right.
and then run those images through DeepGlioma to get a rapid and accurate diagnosis.
Exactly.
It's almost like bringing the expertise of a specialist to places where it might not have been available before.
That's exactly the idea.
And this rapid diagnosis can be incredibly valuable, especially in time-sensitive situations.
Right.
Imagine a case where the surgeon needs to make a critical decision during the operation.
Yeah.
Having that molecular diagnosis in minutes rather than days could significantly impact the course of treatment.
Absolutely.
And it's not just about individual patient care. We also talked about the potential impact on clinical trials.
Yeah.
DeepGlioma could help researchers identify eligible patients more quickly, accelerating the development of new and more effective treatments.
That's a key point.
Yeah.
By streamlining the process of patient recruitment, we can potentially speed up the pace of research and bring those groundbreaking therapies to patients sooner.
It's amazing to think about how this technology is not only improving care for individual patients, but also advancing the field of glioma research as a whole.
Yes.
But let's shift our focus to FastGlioma, the AI system designed for real-time surgical guidance.
Okay.
One of the things that really struck me about this technology is its speed.
Uh-huh.
Analyzing images in under 10 seconds is just remarkable.
Yeah.
But what are the real-world implications of that kind of real-time feedback during surgery?
So the key benefit is that it allows the surgeon to maximize the extent of tumor removal
Yeah.
while minimizing damage to the surrounding healthy brain tissue.
Right.
Remember, getting all of the tumor out is crucial for successful treatment, but it's a delicate balance.
Yes.
The surgeon needs to be incredibly precise to avoid harming critical brain areas.
So it's almost like having a second set of eyes.
Yeah.
A microscopic guide that's constantly monitoring the surgical field and providing feedback to ensure the surgeon is on the right track.
That's a great way to think about it.
Yeah.
And this real-time feedback becomes even more valuable in cases where the tumor boundaries are not clearly visible to the naked eye.
Yeah.
We talked about infiltrative gliomas,
Right.
which tend to spread out into the surrounding tissue, making them very difficult to remove completely.
Right.
FastGlioma can detect those microscopic tumor cells that might otherwise be missed,
Yeah.
helping the surgeon achieve a more complete resection.
It must be incredibly reassuring for both the surgeon and the patient to know that they have this cutting-edge technology assisting them.
Absolutely.
But as with any new technology, there are bound to be challenges and limitations.
Right.
What are some of the hurdles that researchers and clinicians are facing as they implement these systems in real-world settings?
Well, one of the key challenges is the need for large and diverse data sets to train and validate these AI models.
Right.
The accuracy of AI depends heavily on the quality and quantity of the data it's trained on.
Yeah.
If the data set is limited or biased, the AI might not be able to generalize its knowledge to new cases,
Right.
potentially leading to inaccurate results.
So it's crucial to ensure that the data used to train these systems reflects the real-world diversity of brain tumors and patient populations.
Right.
Otherwise, we risk developing AI that might not perform well in all situations.
You're exactly right.
And building those large, diverse data sets requires collaboration between multiple institutions and researchers,
Yeah,
sharing data and expertise.
absolutely.
Fortunately, we're seeing increasing efforts to create open-source data sets specifically for this purpose.
That's encouraging.
It highlights the importance of collaboration and data sharing in advancing the field of AI in medicine.
Absolutely.
But data is just one part of the equation.
Right.
What about the systems themselves?
Okay.
How do we ensure that they are robust and reliable in the often hectic and unpredictable environment of an operating room?
That's another important consideration.
Right.
These systems need to be able to handle variability in the quality of the input data without compromising their accuracy.
Yeah.
For example, the tissue samples used for analysis might not always be perfect.
Right.
There might be artifacts or other factors that could interfere with the AI's ability to interpret the images.
So it's about developing systems that are not only accurate, but also resilient,
Yes.
able to perform well, even under less than ideal conditions.
Right.
This is where rigorous testing and validation become crucial,
Yeah.
ensuring that these systems can be trusted to make the right decisions in real-world clinical settings.
Absolutely.
And as we continue to refine these technologies, it's important to keep in mind that they are tools, not replacements for human expertise.
Yeah.
The ultimate decision-making still lies with the healthcare professionals who are using these tools.
Absolutely.
So it's about finding that right balance,
Yeah.
that synergy between human judgment and artificial intelligence,
Right.
where each complements the other to provide the best possible care for the patient.
Exactly. It's a collaboration, a partnership that holds immense promise for the future of brain tumor treatment and healthcare as a whole.
And as we conclude this deep dive, I want to bring us back to that focus we mentioned at the beginning.
Okay.
The potential of these technologies to democratize access to specialized care,
Yes.
particularly in low and middle income countries.
Right.
We talked about how traditional methods of diagnosis and treatment often rely on expensive equipment and expertise that may not be readily available in these regions.
Right.
But SRS microscopy and AI-powered diagnostics offer a different approach.
Right. They provide a more portable, affordable, and user-friendly way to deliver specialized care. Remember, SRH microscopes are relatively compact and don't require the same level of infrastructure as traditional pathology labs.
Yeah.
And the AI models, once trained, can be deployed on devices like laptops or tablets,
Right.
making them accessible even in remote areas with limited internet connectivity.
So we can envision a scenario where a healthcare worker in a rural clinic can perform a biopsy,
Right.
use a portable SRH microscope to get those microscopic images,
Yeah.
and then run those images through an AI model on their tablet to get a quick and accurate diagnosis.
Yeah.
It's about empowering healthcare providers in these regions to make timely and informed treatment decisions,
Absolutely.
potentially saving countless lives that might otherwise be lost due to delays in diagnosis or lack of access to specialists.
That's the hope.
And while there are certainly challenges to overcome, the progress we've seen in recent years suggests that these technologies hold immense promise for improving global health equity in the field of neuro-oncology. It's inspiring to think about a future where every patient, regardless of where they live or their socioeconomic status,
Yeah,
has access to the best possible care.
absolutely.
And that brings us to the end of our deep dive.
Okay.
We've explored the science behind SRS microscopy,
Yeah.
delved into the intricacies of DeepGlioma and FastGlioma,
Uh-huh.
and discussed the real-world implications of these groundbreaking technologies.
It's been a fascinating discussion.
But as with any deep dive, we surface with more questions than answers.
And that's the beauty of exploration.
Absolutely.
It sparks curiosity, challenges assumptions, and inspires us to keep learning and pushing the boundaries of what's possible.
We hope this deep dive has been tailored just for you,
Yes.
providing a focused and efficient way to understand this exciting area of research.
Absolutely.
We encourage you to continue exploring, to investigate further, and to ponder the possibilities that lie ahead.
Keep diving deep.
And remember, if you have any follow-up questions or thoughts, please don't hesitate to reach out. We're always eager to continue the conversation.
Until next time.